Good morning, sir. For this morning, I will be assessing the breast and axilla of my patient. So firstly, I'll be assembling all the equipments. So I have here the gloves and the alcohol for hand washing. So firstly, I'll be introducing myself and I'll be checking my client's identity and I'll be explaining the procedure to her, why is it necessary and how she can cooperate. So good morning, ma'am. My name is Archelin, ma'am, and I will be your student nurse for this morning. Ano sa imong pangalan, ma'am?
Risha.
So, for this morning, ma'am, mag-assess ko sa imong breast, ma'am, and I'll be inspecting if there is attention nga need para sa imong diagnosis, ma'am. Is it okay for you, ma'am? Yes. So, upon explaining the procedure to my client, I will be proceeding to the next, which is I'll be performing a hand hygiene. So, I will be disinfecting my hand using an alcohol. And then I'll be wearing a gloves to observe appropriate infection control procedure. After my hand hygiene, I'll be proceeding to the next procedure, which is I'll be providing a privacy to my patient by closing the doors and by draping the room so that I'll be able to provide a privacy to my patient. So next is I'll be asking my client for any history of breast masses, pain, or tenderness in her breast, and if ever nga. And I will need to know if that tenderness or that pain is during her menstrual cycle or just in a normal day. And also, I'll be asking if na-ay discharge. So, ma'am, kanang na kay ginabati nga sakit sa imong breast, ma'am?
Sa kwan. Ito naman.
So, kanang kuha na siya, ma'am. Akakuha na siya sa hormones usahay, ma'am. Kung during sa imong menstruation, ma'am, na siya discharge, ma'am, or wala? Wala. So, upon asking my patient, there is a pain during her menstrual cycle, but there is no discharge. So I'll be proceeding to the next procedure to examine her breast. I'll be asking my patient if she is in her menarche age, menopausal age, pregnancy after birth, after age of 30. And then if my patient is using a oral contraceptive and if she is having an estrogen therapy and obesity, high fat diet, and alcohol consumptions. So next is I'll be inspecting the breast for any size, symmetry, and contour or shape while the client's in a sitting position. So I'll be looking at the breast for the size and the symmetry and shape also. So for the size is enough for the size of my patient, and it is symmetric, and the shape is the two have the same shape. So next is I'll be inspecting the skin of the breast for localized discoloration or any hyperpigmentation or any retraction, dimpling, swelling, and edema. So upon looking at it, there is no discoloration, it's just normal. And there is no hyperpigmentation also, and there is no dimpling. So I'll be emphasizing if there is any retraction by having the clients raise arms above the head. So ma'am, pwede i-raise niyo yung arm, ma'am, above the head. So there is no dimpling. So sunod is I'll be asking my patient to push hands together with elbow flexed. So lastly is I'll be asking my patient to press the hands down on the hips. So there is no retraction at all. So next is I'll be inspecting the client's areola area for the size, the shape, and the symmetry, color, and the surface characteristics, and if there is any masses or lesions. So the areola shape and color is normal and it is symmetric. There is no presence of any rough skin on it. So I'll be inspecting the nipples for the size, shape, and position, and also if there is the discharge and lesions. So when looking at the nipple, it is normal. There is no skin problems at the nipples. So next is I'll be proceeding to the palpation. So I'll be palpating the axillary, the subclavicular, and the supraclavicular area, lymph nodes. So firstly, I'll be palpating the anterior axilla, so, which is have here. Upon palpating the mid-axilla, the anterior axilla, there is no presence of lesions. So next is I'll be palpating the mid-axillary, which is here. And then next is I'll be palpating the upper part of the humerus. And then lastly is I'll be palpating the posterior axilla. So upon palpating those lymph nodes, I have not detect any lesions or any normalities on it. So next is I'll be palpating the breast for masses, tenderness, and any discharge from the nipples. So I'll be palpating the breast for masses. So palpate ko, ma'am, ha. So upon palpating, I have not detect any masses and discharge on it. And then next is I'll be palpating the areola and the nipples for masses and any tenderness on it. So ako i-touch it, ma'am, ha. Upon palpating, there is no masses and no discharge at all. So if ever my patient is having a discharge on her nipples, and it is important to note the amount of the discharge, the color, and the consistency, and if there is an odor, to note and to know and to report it to the attending physician. And also I'll be noting if there is any tenderness and palpation, because it is for the diagnosis of the attending physician. And for my patient, there is no abnormalities, so it is normal. So you kanang wala kay kinahanglan ikawala ka, ma, because it's normal. So that will be all for the after that is I'll be documenting all the findings and I'll be reporting it to the attending physician, and that would be all for the breast and axilla. Thank you.